Hello, and welcome to the Think Moisturizer, Think Ajanta podcast series coming live to you from Dermacon. This series is going to get some of the distinguished dermatologists to decode some of the skincare everyday concerns simply, scientifically, and without any hype. Today, we are going to focus on a very interesting topic which is usually very neglected and it affects everyone at some point in time, that is, skin dryness and moisturization. Hi, I'm delighted to welcome Dr. Preethy Harrison with us. She's a consultant dermatologist in Kochi. Hi, Doctor. Hi. So I'm going to ask her some everyday skin concern issues that we all face, but we usually neglect them. So, Doctor, are you ready for my first question? Sure. So my first question to you is that normally people feel that moisturizers are usually only for dry skin condition. So because it's a habit that we feel if it's winters that are approaching, my skin is going to get a little more drier. That's when I should be using moisturizer. So is it the right thing to do? Because with so many moisturizers now out in the market, and so many ingredients and so many different indications that we keep seeing nowadays. There's so many different kinds of promotions that happen with moisturizer. There's something for the day, there's something for the night, there's something for the men, there's something for the women. So, is it really required? Is it really only for dry skin? And does the moisturizer need differ with?
Okay, so I'll come to that, to your question, do you need a moisturizer? I would think that what you said in the beginning about, if your skin is dry, put a moisturizer, which is true, which is like a standard thing that we all do. It can be even oil, right? But that's the old time adage. Now, our understanding is different because when we started using different products, even as simple as maybe old type soap or even face washes, anything, we realize that the skin is getting a little disrupted.
Even the soaps. Even
soaps are the main things. They're very harsh, very alkaline, so not actually, it's kind of not good for your skin at all.
So it's kind of
even those your bad. Yeah, it is. It is making it. So the pH of the skin is 5.5, and you need something to maintain that. So if you put anything, even like a harsh one of those really drying salicylic acid foaming face washes, any of those, anything can they disrupt the skin badly. So then you need to replace that. You need to repair the badly.
And the same goes for the like the body washes and the face washes as well. Like
yes. Yes, so there are harsh soaps,
all the cleanser category.
Absolutely. So that's why there's this importance of using milder products, and especially if you have a skin condition, like if there is a person who's got regular skin, they may not be as affected and may not notice it as much as a person who's got, say, an eczematous condition or a slightly dry skin. So there is where the role of moisture is very important, because it's not just that your skin is dry, it is actually your skin is damaged and you want your skin to be healthy and repaired, and that's why you need a moisturizer. So even in acne, there is a level of skin barrier disruption, and that is why it's not just oily skin alone. Yes, there is oil, but there's also damage to the healthy barrier, and that's what also needs to be repaired.
So there's this typical understanding that that if I have a oily skin, why do I need a moisturizer? Because typically, I think each one of us, when we are in the teenage, typically we have a oily skin, and we feel there's no need to use a moisturizer. It's only when we start aging or whatever we feel that there's a need for me to use some kind of product. So is this the right convention? Like I said in the beginning, that people feel moisturizer is only for dry skin. And then there's a concept that moisturizer is also required in oily skin. But when actually you have oily skin, you don't feel like using a moisturizer. So what is that gap?
So that's what I was telling you. So acne is not just only oily skin. Yes, there is oil, there is excess seborrhea, which is excess production of sebum, all that. But that's actually focal to certain areas of the skin. The what happens in acne is actually a little more than just through small areas of oil. there's a lot of inflammation which happens as well.
Correct.
There's a lot of deficits which go on, which finally
Correct.
acne forms is a process.
Correct.
And what we need to realize is we might actually end up using different medications, products, whatever it is for acne, that can in turn actually damage our skin.
Okay.
So that also needs to be repaired, right? That you need to take care of that. So you have to repair the epithelial barrier,
Okay.
even in acne.
Okay.
And that's why you need a moisturizer in acne, because you will be also using certain drying products to control the oil production.
Correct.
So you need an oil. I mean, you need not an oily product. You need an appropriate moisturizer, which will not increase the oiliness of your skin, but at the same time will keep it hydrated.
I agree. So that brings me to the next question as to your opinion on using comedogenic and non-comedogenic type of moisturizers, because nowadays we see non-comedogenic written on the moisture labels. So does that have any significance in your practice as a doctor? And do you consider before prescribing that whether or not I'm prescribing a comedogenic or a non-comedogenic kind of a...
Yes, you have to look at that, because a non-comedogenic moisturizer is what we want to prescribe in those who are prone to acne, and especially the ones who are maybe even younger. Okay. The older, mature skin may not have too much of acne, so you may not really be so worried about it. But in younger acne skin, yes.
Okay.
And I think it's a good thing for people as such to read the label and to identify it is not
Because there's so much awareness already.
Yeah.
Because if you see the social media is flooded with so much
Yes.
information, but there's an information overload also, I feel.
Yeah.
It is.
It is. So finally, at the end of the day, actually, social media or any of these little, influencer posts are not going to be able to make your good decision. You really need to see a dermatologist. So I don't think there's two ways about it.
Yeah.
So,
I think that clearly comes out that you need a dermatologist to really guide you based upon your skin type, your age, your weather conditions.
Correct. Because someone has to look at your skin,
Correct.
see what it's about. There is a reading that a dermatologist takes on the skin.
Correct.
That reading is available only to trained eyes.
Correct.
And that is what that training actually makes your doctor suggest what will work for you.
Correct.
It's not one size fits all.
So that brings me to a very interesting but the last question that I have is that there's so many trends going on where you say there's a 5-step routine and then there's a 10-step routine for the skin. I didn't even know that for skin you can have a routine as such.
Yes.
And I think that is also a result of so many products coming in the market that everyone wants to fit in within the routine. So that is what I'm feeling. But as a dermatologist, as an expert on this series, what do you feel? Does the skin really require so many step routines? Because one is the paucity of time,
Yes,
to
absolutely.
do so much is one thing. Because you can get excited seeing a video that somebody's applying cleanser also and a moisturizer serum also and everything that looks very fancy, and you might want to follow that trend, but
it's not practical.
It's not practical.
And it's dangerous. It might backfire. So the answer to that is, I don't think any 10-step routine is something that anyone needs to follow, because you're putting way too many things on the skin, which you don't know is helpful or not. Actually, most of the time, by the time you reach the 10th step, I'm sure there is significant damage done to the skin. So nowhere in the world is any dermatologist going to tell you, let's do 10 steps to 10 products, one after the other. I don't think. I think world over there will be a uniform message. So all the influencer posts that you see about doing this is, to some extent, is to promote a little bit of self-care. So there might be a little bit of a massage or cold stone, those kind of things, which may be just harmless if you just put in cold stone. But number of products, no, absolutely not, because it might be counterproductive.
So to summarize our conversation, I feel that you're saying that individually each product might be good, but using them together as a routine, step by step.
Yeah, too many of them, because there will be a lot of overlap, and even your preservatives, your ingredients, all this will overlap.
Correct.
And you don't need so much.
Correct. Correct.
You don't need so much.
I think, doctor, that's an eye opener. I think from this conversation, what I and my audience might have picked up is one thing, that you don't need so many products on your skin, even if they're individually good, but one after the other on your face, I don't think that is required. And I was surprised to know that something as simple as a daily routine thing that we all do, like a soap or a cleanser, can actually damage your skin very often, and that might also be resulting in dry skin, right?
Absolutely.
So I think that was really insightful, Doctor. Thanks for joining us.
Thank you.
This is coming live to you from Dermacon 2026. We are in Bangalore and we've been joined by Doctor. I think this was really insightful, and please stay tuned for more such interesting insights. And we'll get back to you with some more interesting topics.
And even this is not, it's not like over, because you will need to visit your dermatologist in person,
Yes.
not even a teleconsult.
Correct.
You need an in person to look at you.
Like she said,
Yeah.
they are trained eyes to judge your skin properly. So I
Absolutely.
think that they're doing fantabulous job in that. So please take a recommendation from your dermatologist whenever you choose any product. It's just for your own safety, because there might be so many products that you might want to try, but which is the right one for you. I think we have trained people to tell you about that. We should always take consultation from the dermatologist. Thank you so much, Saga.
Thank you.
Thank you for
Pleasure.
joining. And please stay tuned for more such